What is the role of normothermic cardiopulmonary bypass in metabolic management? A. To reduce the need for glucose administration. B. To preserve cellular function and reduce metabolic demand. C. To improve oxygenation by increasing body temperature. D. To reduce the risk of bleeding. Answer: B. To preserve cellular function and reduce metabolic demand. Explanation: Normothermic CPB, where the patient is kept at a normal body temperature, helps maintain cellular function and reduces metabolic demand. Hypothermic CPB, on the other hand, is often used to protect organs but can cause metabolic disturbances. Normothermic CPB reduces the risk of these disturbances, especially for the brain and heart. Which of the following is a complication associated with high-dose corticosteroid use during cardiopulmonary bypass? A. Increased risk of infection. B. Reduced blood pressure. C. Hyperkalemia. D. Severe acidosis. Answer: A. Increased risk of infection. Explanation: High doses of corticosteroids during CPB are used to suppress inflammation and improve hemodynamics. However, prolonged or excessive corticosteroid use can suppress the immune system, leading to an increased risk of postoperative infections and delayed wound healing. How does the use of the oxygenator during cardiopulmonary bypass influence metabolic management? A. It helps remove excess CO2 and prevents respiratory acidosis. B. It increases oxygen consumption by tissues. C. It supports metabolic processes by providing additional nutrients. D. It decreases glucose metabolism in the tissues. Answer: A. It helps remove excess CO2 and prevents respiratory acidosis. Explanation: The oxygenator in CPB mimics the function of the lungs by removing CO2 from the blood and oxygenating it. This is crucial for preventing respiratory acidosis, which could result from the accumulation of CO2 in the bloodstream during the bypass procedure. Which electrolyte imbalance is most commonly seen after cardiopulmonary bypass, especially in patients with prolonged surgery? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. Hypocalcemia. Answer: D. Hypocalcemia. Explanation: Hypocalcemia is a common electrolyte disturbance after CPB due to the use of citrate in the bypass circuit, which binds calcium and lowers its levels in the blood. Monitoring and correcting calcium levels is important during and after surgery to prevent complications such as arrhythmias or bleeding disorders. What is the role of glucose monitoring during cardiopulmonary bypass in diabetic patients? A. To ensure stable insulin requirements during surgery. B. To prevent hypoglycemia. C. To detect electrolyte disturbances. D. To ensure that glucose is used as the primary source of energy. Answer: A. To ensure stable insulin requirements during surgery. Explanation: For diabetic patients undergoing CPB, glucose monitoring is critical to ensure that insulin levels are properly adjusted during surgery. Tight glucose control is necessary to prevent hyperglycemia, which can increase the risk of infection and complications, and to avoid hypoglycemia, which can lead to neurological impairment. What is the impact of hyperkalemia during cardiopulmonary bypass on the heart? A. It can lead to arrhythmias and impaired myocardial function. B. It improves myocardial contractility. C. It stabilizes the heart's electrical conduction. D. It enhances the heart's ability to pump blood. Answer: A. It can lead to arrhythmias and impaired myocardial function. Explanation: Hyperkalemia during CPB can impair the electrical conduction of the heart, leading to arrhythmias, such as ventricular fibrillation or asystole. Potassium must be closely monitored and corrected to prevent these dangerous complications. What is the effect of acid-base imbalances during cardiopulmonary bypass on the body's metabolic processes? A. It has no significant impact on metabolism. B. It can impair enzyme function and disrupt cellular respiration. C. It enhances the activity of glycolytic enzymes. D. It improves tissue perfusion. Answer: B. It can impair enzyme function and disrupt cellular respiration. Explanation: Acid-base imbalances during CPB can impair enzymatic activity, which is essential for cellular respiration and metabolism. Altered pH can affect metabolic processes, leading to poor tissue perfusion, organ dysfunction, and other complications. Maintaining a normal pH balance is crucial for proper metabolic function. Which of the following is most likely to cause electrolyte imbalances during cardiopulmonary bypass? A. The use of heparin during the procedure. B. Hemodilution caused by the bypass circuit. C. Hyperglycemia during surgery. D. High-dose insulin administration. Answer: B. Hemodilution caused by the bypass circuit. Explanation: Hemodilution during CPB, which involves the dilution of blood with the perfusate, can lead to significant changes in electrolyte concentrations. Reduced blood cell concentration may impact the balance of ions like potassium, calcium, and sodium, potentially leading to electrolyte imbalances. What is the effect of cardiopulmonary bypass on the body's oxygen consumption? A. It decreases oxygen consumption due to lower metabolic demand. B. It increases oxygen consumption by increasing cardiac output. C. It does not affect oxygen consumption. D. It decreases oxygen consumption by reducing perfusion to organs. Answer: A. It decreases oxygen consumption due to lower metabolic demand. Explanation: During CPB, the body is typically in a state of reduced metabolic demand, as the heart is not actively pumping, and organs receive artificial perfusion through the bypass circuit. This reduced activity results in a lower oxygen consumption compared to normal physiological conditions. Which of the following strategies is essential for preventing myocardial injury during cardiopulmonary bypass? A. Maintaining high glucose levels in the blood. B. Using high-dose corticosteroids. C. Ensuring adequate myocardial perfusion and oxygenation. D. Increasing the rate of fluid administration. Answer: C. Ensuring adequate myocardial perfusion and oxygenation. Explanation: Adequate myocardial perfusion and oxygenation are critical for protecting the heart muscle from ischemic injury during CPB. Maintaining optimal perfusion pressure and oxygen levels prevents cellular damage and minimizes the risk of myocardial infarction or dysfunction during the procedure.